Doing this in... All right, man. Thanks for joining us today, Dr. Grant.
Thanks for
And I've
having me,
already
sir.
man, glad to have you, man. So fill us in, man. Like, how's life now that you are officially doing your own gig? Tell us about your business, man.
Yeah, life is awesome. It's never been better, I'll be honest with you. Like my wife and I are kind of a little in shell shock after leaving our corporate medicine jobs and being in having a structured life for the last near 20 years, going from med school through residency through working, and now we don't really have a daily schedule per se, and it's
That's
been
awesome.
awesome, but it's hard to get used to, especially for anal retentive people like we are.
Sure.
Uh, but it's been such a blessing, man. Like we didn't realize how stressed we were until we got out.
Yeah,
And I think a lot of people probably are in that boat, just in not just medicine, but in corporate life, period.
sure.
Uh, and, because that's the American way, right? It's just have your corporate job and get your mortgage and,
And work your ass off and,
your ass
see your
off.
wife
And
once a week.
that's right. See your wife once a week, never see your kids, buy a lot of stuff. And, I'm not saying that everybody's got their own thing, but for us, that wasn't it.
Sure.
And
Yeah.
just being able to spend more time with patients now on my own terms. I'll do 2 or 3 in the morning and I'm done, but I can spend whatever time they really need. Friday, I had a guy come in from New York City, and we spent 2.5 hours together just
Hell
chatting in the
yeah.
office. Like you can't do that in a corporate job or even a self-employed like urology job. You can't do that, and
No.
the private practice urologists are actually having they're way overworked compared to the corporate guys. They're seeing 50 patients a day in a urology clinic and taking call and doing surgery. And I know they're miserable. I mean, a lot of them pretend like they're not, but
There's no quality
urology,
life, man.
yeah, there's
None.
not. And actually, urology is the number one most hated medical job, according to last year. I think it was the New York Times, and this year the AMA survey. Urologists are the least happy and the most depressed. So it's kind of interesting.
That's not good, man. Y'all are so
Yeah.
needed though. That's the thing.
Yeah, I know. I mean, that's the thing. It's an interesting specialty, but a lot of things need to change just in medicine and in general. And I don't
Sure.
think that going to happen anytime soon. So I do think you're going to see more of the kind of DPC model, like the concierge or cash pay, direct primary care. Same thing with hormone clinics. I think you're going to start seeing a lot more of that as
Yeah.
providers get frustrated and just start leaving the system.
And that's kind of sad because you think about like, where's pediatrics nowadays? Do you even see pediatricians? They're getting what,
I know.
125 a year, go to school
Yep.
all their life. It's kind of a
Yep.
dying profession. Nephrology is also something that's kind of dying. It's really sad now.
It is, and I don't know the ins and outs from the higher up down and what all the connections are and what's really going on. You just kind of see the big picture. And working for both, we did 2 years for a private urology clinic in Shreveport, and we kind of saw how that worked. And then we did 5 years corporate medicine in Paris and saw how that worked. And you kind of realize it's not all rainbows and sunshine, even on the private practice model. Like once you get big enough, you're playing the same games as you are in corporate,
Yeah.
if not worse, actually. At corporate, you're a little more shielded. Academia, if you do that, you're obviously a little more shielded, but the expectations are different, and a lot of those people are getting burnout too. And then depending on your political persuasions, but you don't have a choice. Like the wokeness, if you're not into that, it's pushed on you no matter what, and
Yeah.
that's filtering into how they choose residents and you know what I mean. Like you can't avoid it, and that gets frustrating for people when they're like, we should be doing this based on different standards. So it's just there's a lot of mess in so many areas. We kind of saw the writing on the wall, and I could probably give you 100 different reasons that we left. Um, but regardless, it's been very freeing and rewarding. And I think it's been amazing how many of my prior patients actually came along. I was just so blessed with
Yeah, no
that. And
doubt.
they're excited for it. They're like literally like, "Hey doc, I'm so excited you finally got out." It's just like, it's so cool. It's like we're all on this like little journey together. So it's neat.
So now that you've shifted from that into more of the private model, how's that affected like your own like personal life? Not
Oh,
the professional life. We already know that you're busy as shit with that, but the
yeah. I
personal
mean,
life, how's
I
that going?
kind of cut off taking new patients a couple weeks ago because it was starting to get overwhelming. But man, personally,
And
it's
that's a
been
blessing in itself too, man.
yeah.
That's a
Oh, yeah. I was
milestone.
like, yeah. And and that's probably temporary. I mean, it's more just gives me time to breathe and catch up with emails and really kind of get on some cruise control, and then eventually kind of open back up once I know how things are going to go. Um, because we're only like what 5 months into this. So, but personally, we're better than we've ever been. I mean, our marriage is better.
Hell yeah.
Um, our
Props.
enjoyment of every day, like just being able to take the day for what it is and not,
Dude, seriously.
like, it's just, it's hard to describe. And I had talked to my cousin about this. He's been self-employed for since he got out. I mean, it's forever. And he's like, you're never going to want to go back. You're not going to want to go work for the man ever again because, we control things on our own terms for the most part. I mean, yeah, there's still some hoops to jump through, and that is business and personal, obviously mixed. But because I can have more control of the business side, then the personal side can shine a bit more, and
Hmm.
we have more
Oh, yeah.
freedom. And it's we can travel, we can see things. We don't have kids, so and that's just one of those things that never happened for us. So it's not the typical situation, and we get that, but we want to make the most out of what we're doing now. And so just having the ability to visit family when we want to, things that we were
Hmm.
not able to do for the last 15, 20 years because
Oh,
we're
yeah, because
stuck
you
in.
got to request
Yeah.
off 6 months in
Yeah.
advance to take a
And
day
then
off.
you get punished for taking time off because you get a week behind, and then you got a week's worth of patient calls and all that, and
Yep,
on-call issues that built up. Like it was actually more stressful to take a vacation when we
it
were
was.
urology. Yeah.
Dude,
Yeah.
I totally know how you feel, man, because you'll check your inbox,
Yep.
whichever, I don't know which EMR you used, check your inbox, there'll be 150 messages, some missed calls. You're like, why the hell
Yep.
do I even take time off? What's the
And
point?
yeah, no, I totally agree. It was for me, it was not like nausea inducing. I could, and I would still keep up with calls while I was on vacation. My wife would be like, "What are
Yeah,
you doing?" But we both find ourselves doing that because if you get behind, you're never going to catch up.
you never catch up.
So no, man, it's been great. Like I think I never knew what to expect, and now that it's here, we're still kind of shell shocked. We're like, is this reality? Like it feels wrong. You feel wrong for having time to yourself to do other things. It's not like we're sitting around being lazy. I mean, we always find stuff to do. That's the interesting thing. It's
Man,
sort of
I'm
the
happy for you. That's
yeah,
awesome. I love
yeah.
that.
Each day takes care of itself, basically. So
So you're just living in the moment, enjoying the
yeah,
present,
I mean, we
enjoying every
really
moment.
are. Absolutely. For so long we had our steps planned out for us. I mean, obviously you never know what's going to happen tomorrow, but otherwise you know that every day what it's going to be like, what your weekends are probably going to be like. It's just the same thing over and over. And now it's sort of like, hey, what are we going to do today? Hey, you want to go out there and pull some fence and chop down trees? Okay. Hey, do you want to go see the family? I mean, just it's cool. Yeah.
It's like you get to go on day dates with your wife, and you're like, I haven't done that
Exactly.
since I met you in college. It's such
And
a weird
that's
thing.
That's interesting. Leah was saying the other day, it feels like college again. It kind of does because
Dude,
you
that's
have,
such a good phrase.
it's which was great because you have a few things you got to do, a few and then after that, your time is kind of your own as long as you're staying up with the stuff you need
Yeah.
to, and that's kind of how it feels. Yeah,
I know I can totally relate. Like sometimes me and my wife just on a Tuesday, we'll just go on a hike for the shits and giggles. Hey babe, you want to go on a hike? Let's do
that's
it.
right.
It's
Yeah, and I
it,
love that
it's
y'all have the best place in the world to do that too, man. You guys are That's awesome.
hey, you're close to the Wichita Mountains, man. Which
Yeah,
you're up. You got the mountains there too.
we're there. We actually found a waterfall yesterday. We took a trail on the side by side, and trail was closed off. And we just started walking. All of a sudden, we find this waterfall, and like, there's just little hidden gems, and just being able to just enjoy that. Like, what was that on that was on a Sunday, but we can do that on a Monday or a
Mhm.
Tuesday, 2 in the afternoon. When used to, we're like, oh God, we got to get back to clinic. We got to, we're just so frustrated,
Yeah.
and yeah. So that's I think life kind of opens up once you have a little more freedom. And I wish more people kind of would do that. Honestly, I think, it would change everything as far as the landscape probably of economics and everything. But I think so many people are just roped into the I have to do it this way and this way
Yeah.
only. And they're scared, and I get it. It's scary to go out on your own. I mean, I can't lie that we had a good base to start from. I mean, I didn't know if any patients would sign up that I already had. I was hopeful they would, and so we kind of still had to take that leap. But I knew we had to do it no matter what. So
Yeah. And it speaks to your knowledge though. It speaks to your professionalism, your knowledge, your contributions to this industry. So and people respect that. People appreciate you, man.
awesome. Thank you.
But I have a feeling though that you now that y'all get more time off, your wife's gonna be stepping up her photography game too, though. I have a
She
feeling.
is she is itching to get back into that. So we're actually going to go on a 4-week trip starting in June. We're going to start with the part 4 of the World Link course up in Salt Lake City, and
Oh wow.
it's going to kick off a 4-week road trip through Idaho, Oregon, back through Utah, through Zion, Colorado. Like, it's going to be
Hell yeah.
epic. for
Taking
landscape. She
the
does.
pups
She
with
loves
you?
it. What's that?
The pups going too?
Oh yeah. Oh man. Yeah, she can't stay anywhere without us. We go to mom and dad's house and she gets anxious just being there because she thinks we're going to leave her. So
Oh,
yeah,
that's
she
sweet.
goes she goes with us everywhere.
That's
So
awesome, man.
yeah.
So now what's the next step after you get back with your business? Tell us a little more about what you expect from the business the next, let's say, one
I
or 2 years.
I don't know, honestly. Like that's the other thing. It's like I don't know where anything's going to lead. I like the idea because we're doing a subscription model, and
Yeah,
once you get your guys, if we're not having a lot of new patients, life does get easier because you're kind of on cruise control with your
sure.
guys, and it's just enjoyable because you built relationships with them. I mean, I talk with my guys like friends. I mean, we shoot the bull through Messenger. It's not just about not everybody. Obviously, some I never hear from, but maybe twice a year. Others like every other day they're shooting me a link to an exercise video or hey, have you heard about this? And we'll just kind of shoot the bull. So from that standpoint, that's what I'm most looking forward to is just getting on cruise control with my guys and enjoying building those relationships. I mean, obviously, I can't lie; it's nice having a steady income stream that way. If they stay signed up,
Sure.
uh, and not having to worry though about the corporate paycheck stuff and all that. And from a business standpoint, we're non hormone related. We are looking to figure out how to diversify, as far as like
Hmm.
other ways we can build up passive income, which everybody's into now, right? Passive income. But we're
Can't
kind
blame
of,
them. Yeah.
yeah, and we're a little risk averse. And so it's kind of scary to me to get into like the real estate game and all that kind of stuff. I don't want rent houses, but I do want something more than just my Vanguard total stock market index fund. You know what I mean?
Yeah.
And I'd like to do something that actually does benefit other people. Like that's a big part of what we were wanting to do was to use strengths that we have maybe and even income that we have to help other people, like in whatever that means, and whether it's charity or whether it's providing a space that they can lease out. So we thought about maybe getting into some like medical office type stuff, just but do it in a way that's maybe a little unique. I don't know yet. And so now that we have time, I can at least look into that kind of stuff because back in a year ago there was no way that was ever on the horizon.
No,
So,
no, absolutely not. What about Leah? Does she get into the game too, or she start taking some folks?
she's taking patients. She wants to stay pretty small. She's really mainly a lot of seeing friends, like referrals from friends or wives of my guys. And so she doesn't want to have more. She's probably got about 70 patients right now. I bet she'd cap it at 100 if I had to
Yeah,
guess, just to keep things, smooth sailing. Because she has other stuff she likes to do, and she always finds stuff to do every day. I think we have
that's
like
good.
700 people signed up right now. I mean, or potentially signed up. And that's why I kind of capped it. Like once I saw that number, I was like, I need to kind of slow down for a minute and just catch my breath.
Yeah, I
But
mean,
yeah,
it's a new endeavor, and
yeah,
you have passions outside of medicine, which is great.
exactly. And I think that's another reason I wanted to slow down was like, I still have so many other things I want to start looking into, whether it's hormone related stuff that I haven't had time to do. Because there's so many things which we'll probably talk about that we still don't really know, and I may not figure it out by reading papers, but I like to at least get the background knowledge on a lot of this stuff, and I haven't had time to do that the last however many years. I mean, I did the deep dive into the estradiol issue obviously about 5 years ago, and that was pretty enlightening. But that just opened up that rabbit trail that there's so much more of this stuff that we think we know, and you start reading like these foundational papers, you're like, well, that's not at all what we've been talking about.
Sure,
So it's
isn't
pretty
it?
cool.
And that's how you can discern someone who's an actual expert versus someone who's a bullshitter. It's because they're like, I don't know, maybe not, maybe it is, maybe it isn't.
I
They
totally
always
agree.
express a sense of doubt, a sense of doubt.
Exactly. And you see that in like the exercise science world, right? When you see guys who truly know, like Brad Schoenfeld, they'll be like, this may mean this, but we don't know for sure. It's like or it depends. If you see a lot of it depends, it's individual. Now we're getting somewhere, right? Because you can't really extrapolate individual things to a universal proposition. Like you can't do that because everybody is different.
Yeah,
Sort of like the black swan issue. Just because you count 1,000 black swans doesn't mean the 1,001st won't be white, right? Like you don't know. And so we try to make these averages and bell curves and try to make claims that include everybody. But I always tell people you're an N of one. Every person is an individual.
yeah, yeah.
You're not a statistic. You don't know where you are on that curve. And it doesn't matter about the curve. It matters about you. And I mean, we tell that with patients when they're like, with cancer and stuff, like, how long do I have to live? And I'm like, I would never tell you that. Like,
No telling.
why? How would I know that? I can give you a statistic, but that doesn't mean you're part of it, And it's the same thing with a lot of these other claims we make. So I've gotten way more comfortable getting away from the lab range algorithms to trial and error and just being honest with people that this is going to take trial and error and it's okay. And your labs aren't going to tell you. It's not like we have a little decoder ring that we can wand over you and your blood work just tells you everything that's wrong with you. It just doesn't work like that.
Yeah, yeah. And there's one thing I've noticed: the more I practice, the more you realize that labs are just they're just labs. It's just a number. I mean, that just because you're
Well,
here
tell you
doesn't mean.
something interesting. So this was interesting. So the patient that came to see me on Friday is a biochemist and started his own biotech company. So synthetic chemicals like drug discovery, all that. He didn't realize that the reference ranges for testosterone were not based on therapeutic ranges when given a drug. Because in his mind, that's how it works with drug discovery, right? When they're looking at blood levels, it's based on the drug and the effect. And I was like, no, these are just baseline levels for people not on testosterone. They literally have no meaning when you're taking an exogenous substance. I know people have a hard time understanding that because they're just like, no, I just want to get back into the normal range. It's like, it's two separate issues. When you take something exogenously, you change a lot of stuff going on in the body. So trying to get back into that normal range, well, there's a reason most guys don't feel great when they just get back to normal, right? And I think Keith Nichols talked about that in one of his recent interviews about
Mhm.
the reference ranges and how most guys need to be above that to be, and it's true. I mean, in practice, it's true. I mean, and I think that's where people have a lot of issues because they want a cookie cutter range to go. I want to get there and I'll be fine, and it just doesn't work like that.
Sure. And that it's no different when people say, "Well, if I just had $100,000, life would be great." And then, okay, well, you're there now, but shit ain't changed. You're right
That's
where you
right.
were.
That's right.
It's
Yeah.
that's the concept of chasing numbers is that it's just a number and there's no meaning behind a number. I don't think people
Yeah,
can
well,
grasp
especially
that.
when there's so many variables going on in the body that you don't even know what all the variables are. So we make these assumptions like we know it all, we can control. And first of all, nobody ever controls for those variables. You can't in a living human. First of all, second of all, you don't even know what all variables are there going on. So just because you get a number and you try to correlate it with a symptom, that's just correlation. It doesn't mean it's causative. There can be so many other factors that might be causing both issues, right? And we see that all the time. And so it's just, I think more people are starting to catch on to that, but it's a hard concept, even for people in research, because they want hard data, quote
They need
unquote.
benchmarks and
Right.
numbers.
That sounds great, but that's the methodology that you have chosen. You did not discover that that's the right method. You chose that, and then you hone in on it when it's like, well, but what if it's this other method? What if it's symptom based? Like you're not, and I mean, that's a philosophical discussion. Same thing with laws of nature. People choose the equations they want. They're not discovered. Like, and that's fine to try to hone in on something you're looking at. But in research, medical research, certain outcomes are chosen to look at, and then everything's structured to try to find that outcome when it's like that might not be the proper outcome.
Sure.
Like, do AIs lower estradiol? Yeah. So what?
So
Why would
what?
you want to do it? You know, like eh, it's just it's a different mindset. And I'll have guys look, well, look, they did these studies with AIs and they brought sperm counts back up. Yeah, we know that's not the point. You know what I mean?
Okay.
Like, so what? So yeah, I think more people are catching on. I hope. I don't know about mainstream medicine. They're still very much lab focused.
Yeah.
I have guys all the time that tell me that their providers, they're like, their hematocrit's 50.1, and they're like, oh, you're getting a stroke. And it's like, are you kidding me? Like the normal range used to go up to 55. Like,
Yeah.
it's just sense.
And
So
I've
I
actually
could
got some clients like in Arizona, and some of their labs goes up to the hematocrit range goes up to 60.
exactly.
And I'm like, no, if you're normal on this one, but you're not on this, then at what point is there any discretion that this is good or bad? You can't discern that. You can't define that.
I liken it to when they changed speed limits. It's like, so it used to be wrong to drive 70 when it was 55, and now it's
Oh
75 and
yeah.
it's okay. So you know what I'm saying? It's kind of a similar thing.
It's
So
like
it's okay
statutory
now.
medicine.
Yeah, exactly. Like, oh, we're gonna grandfather you in. That's what I tell them. Like, I'm gonna grandfather you in back to when it was 55. Like, it doesn't matter. I mean, there's other things going on. I mean, the hematocrit issue is a whole nother topic, but just things like that. I think as long as we get away from the pure reference range mindset, I think you start seeing people actually feel better if
Feel
they get
better.
out of
Hmm.
the mindset too. The patient has to get out of the mindset as well.
That's the
Um,
hardest thing, though. They're
it
so
is.
because as soon as they leave you and they get their yearly checkup with their PCP, it's back
Yep.
to you with all the negatives, or
Right.
they're going to pull them off. That's
And honestly, I've gotten a little more cut and dry with that. I had a guy the other day message me saying his provider wanted to talk to me because his testosterone was 1,040. And I was like, no, I'm not talking to your primary care doctor. I prescribe your testosterone. If you're going to have him check your testosterone, he needs to provide the testosterone for you. I'm not going to joust with another provider.
no,
Like, I
you
don't
got
owe
time for
anything
that.
to your primary care doctor. You don't owe anything to your primary care doctor. They work for you. So, and he was like, "Oh yeah, no, I agree." And it's just like people have to get out of that mindset too, that they all want to please their primary care doctor, any doctor. I'm like, don't even think you need to please me. You need to be an advocate for yourself. Like that's the biggest deal, I think. So
Yeah, and I think as long as they are, beholden to the insurance model that says A stays in A lane, B stays in B lane, and you stay in this range, that's the way it's going to be. I mean,
that's right.
unfortunately, that's not
100.
going to go anywhere anytime soon. That ain't
Yeah,
going nowhere.
there was a big topic about that in one of the women's groups not long ago, and I kind of chimed in because she was kind of frustrated that her insurance wouldn't cover certain things, and I just kind of laid it down like this is how insurance works. It's not that this is part of the system, and as long as you play in their sandbox, you play by their rules.
Play by the rules, man.
It's no different than government, right? People just assume they have to participate in the system. It's like no, you don't. Just because a few bullies have certain sandboxes and they demand you play in them, you don't have to. You can go build your own
Yeah,
sandbox,
go play
you
on
know?
your own, man.
Yeah. So I think that's the bigger picture. Like I try to look at this from a more of a philosophical perspective on all these things. They're all the same. Like you don't have to be beholden to just this one system because everybody does it, right? Like it's just kind of nonsense.
So that kind of brings me to the question, at what point did you say, or what point did you realize that in your career, in your practice, that why are we chasing these estradiol ranges? Why are we chasing these? Or what point did you realize I'm getting out of that? This is nonsense. This isn't applicable to the general population.
I think it's been probably a just slow progression over the last 4 to 5 years, especially after the estradiol stuff. Honestly, looking into that, which is a totally separate topic, because those, people can watch our video on the AI and why not to use one, but you get into the nature of intracrine hormones versus endocrine hormones. And so your blood work, even though even testosterone doesn't tell you as much as you think, with estradiol and DHT, it's almost useless. Like because you're not converting those compounds aren't converting in the bloodstream. We have this idea that you take testosterone and magically poof, it just converts in the bloodstream to estrogen and DHT and they wreak havoc in the body. And it's like, that's not how it works. It has to actually get into the tissues, then is converted
Hmm.
into these things. Well, that's different depending on the tissue. The tissue has different needs, it's designed differently. So once you realize that, you kind of get out of that lab range mindset with those two things. And even DHE and pregnenolone, in my opinion, kind of follow those same rules. And so then you're more trial and error with a lot of that stuff. With testosterone, though, in general, I just realized a lot of guys weren't feeling better when you get them to 700, let's say, in a
Hmm.
free T in the teens, and they're just like, oh, I mean, maybe doc, I don't know. And then you push a little more, and their symptoms start resolving, and it's like, well, there's something to this, And
Yeah.
other doctors, I'm not a trailblazer by any means on that. I mean, Neil Rouzier has been talking about that for a long time.
Oh yeah,
Dr.
like
Nichols,
20, 30 years or something
yeah,
like that.
yeah, it was really a lot of stuff he said that helped me go look deeper into other stuff. And so now that I've done it, I think I finally was just like, I'm gonna have to have the balls to do this and stick by what I say, and let me just try it. And the more I did it, the better people got, and without negatives. They're not running around with growing boobs and having strokes and any of this nonsense that people say is going to happen.
Hmm.
I knew that. I mean, coming from like a big steroid background and having a lot of knowledge on that stuff, that even a lot of that's overblown. Yes, there's dangers. I'm not going to act like those guys are not walking disasters a lot of
Substance
times.
abuse is substance abuse. Let's be real.
That's right. Exactly. But when you do a basic lower dose, to get people just therapeutic, and your body will tell you when there's problems for the most part. Like when you start having resting heart rate of 100 and you feel tight chested and you know what I mean, you're red faced and you can't keep an erection and your testosterone's 3,000, your body's telling you something, like, and so
Yeah.
that's been my protocol with a lot of guys is be honest with yourself. Don't chase the number because you just want to be as high as possible. If you start feeling worse when you go up, come back down to where you felt better. And that's going to be probably your sweet spot within, within reason. And that works most of the time.
Yeah, yeah. And you were just saying like a lot of guys are afraid to grow boobs, but the reality is estrogen isn't it's not going to make you grow tits. It doesn't do that.
The only time I've had gyno, it's still there. It'll regress and grow. It's not with testosterone. Anytime I've taken nandrolone, I'll get the lump and painful, hard, like, well, nandrolone doesn't aromatize. I mean, I know people say, oh, it does 20%. There's no evidence for that. I mean, every study that's done on nandrolone,
Yeah.
it can't undergo aromatization because it's already a byproduct of the aromatization
Yeah. It's
process.
already gone down the process.
Exactly. And so a lot of people don't realize that. So it's like it's probably just that direct progestin activity on the glandular tissue there. Same thing with IGF-1 levels. A lot of guys,
IGF-1. Yep.
yeah,
Hmm.
taking GH or they'll take MK677. All of a sudden they're developing gyno. It's like, well, did your estrogen flare? They want to blame it on estrogen, want an AI. It's like, no, it's just multifactorial. There's stuff going on there that we don't fully grasp. So I don't know how I got off on that tangent, but it's a little more complicated than just this. Oh, it's got to be that one thing, or
Yeah.
to blame. Yep.
There's no such thing when it comes to the hormones as A equals B, or if you take this, you will get that. No, there's no blanket statements to it.
Exactly. If you make these, I had a guy recently wanting to clear up his acne, and he was on injections with grapeseed oil. I was like, well, let's try MCT oil. And he's like, okay, doc. And I said, if that doesn't work, we could try cream. And he's like, okay, so if cream, it'll definitely clear up my acne. I said, there is no definitely.
There's no
I will
no.
say it ain't gonna happen. The only thing I can definitely tell you is that you're gonna die someday, and that's about all I know.
Yeah.
That's
I
it.
don't even know when it could happen tomorrow. It
I
could
don't
happen right now. Who knows?
exactly. Yeah, like that's pretty much. When they say death and taxes, it's like, yeah, that's pretty much it. That's it. So, but you're right. We have to be careful with a lot of the dogmatic claims, and I've been guilty of that in the past when I was early
Sure.
on in this. And the longer I do this, the more I realize how little we truly know. And I use know. I mean, it's fine. Again, that's an epistemological issue. You go down a philosophy rabbit hole and you realize, how do I even know that I'm not dreaming this right now? Right? You can get in that rabbit hole. When I say no, I mean infallible knowledge, like can't possibly be wrong. That that's minimal stuff, right? We are going with opinion, a lot of times consensus, even though we say we shouldn't. That's why I say be honest about that and be honest with each person that we don't fully know. That's why we're going to try to find the best route for you to get you feeling where you want to feel. And I think that's the more pragmatic side of hormone optimization is admitting I don't even care if I'm treating it a quote unquote deficiency or not. I'm trying to make you better, feel better, function better, have
Hmm.
better health. What's wrong with that? I
Nothing.
don't,
Nothing wrong with that.
yeah, yeah.
Have you
So
so on the topic of endocrinology of hormones, like we're even learning that thyroid hormones, those are endocrine hormones too. T3
I,
express itself at the cellular level. The PBN picks it up, and then what's reflected on paper doesn't mean a damn thing to what's going on at the cell. We learn all this stuff every day.
every day.
No,
Yep.
I'm
Yep.
kind of curious what led you to kind of find that like study in the more
So
the intricate side because
the
there's no benchmarks to that. There's
yeah.
none.
Well, you can't. I mean, you can't do it. And
You
I
can't
was talking
measure
about this.
tissue.
Yeah, with my patient on Friday, we were discussing it about how you'd have to literally do tissue biopsies all the time in different tissues, and then you're still correlating levels with symptoms. You don't know if it actually means anything causative.
Mhm.
Nobody's going to do that.
Nah,
Uh, I think what got me into it was the estradiol topic because that's the hot topic. Everybody wants an AI, and I mean, I took an AI when I got on TRT.
dude, I bought into it 10 plus years
Yeah,
ago too, man.
I mean, I felt terrible, and I'd keep my estradiol at like I was unregisterable at one point, because I thought I needed to check it and all that, keep it between 20 and 30 and all this crap. Um, I think the first time a little light bulb moment was in Shreveport. I put a guy on an AI because estradiol, we checked it, it was over 100, and I was like, well, I guess he needs an AI. Well, he felt worse, and I was like,
Mm.
hey, that doesn't make sense. Well, so I took him off that, and we just bumped his dose up on injections. Well, about a month or two later, he comes back. He's like, feel great. I was like, okay. So I just kind of tucked that away. I didn't really think about it too much. And then when I got to Paris, is when I saw Rousier's video with Jay Campbell where he's going over estrogen and all that, all that whole rabbit trail. And it just piqued my interest. But he still never really touched on anything about the blood levels or anything like that. So I finally just started looking at papers on estradiol. And when you start tracking back references, you get back to older papers from the 70s where they were really studying DHEA, which is also an endocrine hormone, right?
Yeah.
And And this guy was started to talk about how these things are converted in the tissues. And you start seeing these little snippets in all these different papers that say serum levels of estradiol are nearly useless in males and postmenopausal females. And it was like, that's interesting. Like, why do they keep saying that? I'm not ever,
Why is
not
it
ever
in
been told.
small footprint? What is that there?
Exactly. You're like, so this is all the researchers are saying this, and these are in these big journals. Why are we not taught this? And I had to figure out why that was. Well, the light bulb moment is once you understand where it's made in the tissues, then you understand that the serum levels are, that's why they're saying it, right?
Hmm.
Because it's not converting, it's not an endocrine hormone at that point. Now that's different if you take a hormone, right? And a lot of guys would straw man me and say, "Oh, Dr. Grant just wants you to take estrogen, estrogen." And I'm like, that's not at all what I said. We're talking about aromatization, which is a conversion in the tissues. Therefore, the blood levels aren't that useful. If you just started taking estrogen, your estrogen in your blood is going to skyrocket, right? We know that. Like, why would a man take estrogen unless he was castrated or needed it for some reason?
Sure.
Most men don't need to be taking estrogen, in my opinion. I think bodybuilders might, when they're taking like no aromatizing compounds, it
Yeah.
probably would
And
be
they're just
beneficial.
completely depleting their body.
Exactly. But once I understood that, then you look at DHT, same thing. It's the same process, converted in the tissues. So all these people want to check their DHT levels and take finasteride and all this nonsense. It's just not necessary. And almost every time you see guys take these things, finasteride and AIs, they feel worse. They have
Yeah.
big issues. And it's like, well, those are poisons by definition. And I know people don't like me using that word. They're like, oh, that's dogmatic. No, just look up the definition of what a poison is.
It's something
Something
that
that
harms you, man.
disrupts a natural process in the
Yeah.
body, right? Well,
Yeah.
that's what you're taking by definition. So, and I know the poisons in the dose and all that. It's like, yeah, kind of, but you're still poisoning yourself. And then you have to ask yourself, why am I doing this? Do I really need to be doing it? Is it a dogma? Do I have evidence that I should be doing it? And I just started asking that question more and more, like, where's the evidence that we should be taking AIs and modulating serum estradiol levels? And it's just not there. There's no evidence, none. And then you get into the anecdote and people with, I'm crying, so it's got to be estrogen. It's like, why do you think that's estrogen? It's all these presuppositions come out in the way people say things. So you kind of got to dive down into that. And you can't spend your life arguing with people like that. But I'm pretty clear with my patients about where I stand on AIs and
Yeah.
5-alpha reductase inhibitors. So they kind of know already. So,
Yeah. That I'm pretty much right there with you, man. That
yeah.
I think my patients already kind of know my suppositions on those as well. First
Yeah.
interview will, I'm sure even if you get new people, the first interview, that'll eliminate them right out of the gates.
It does it, and it'll help them. A lot of them just don't know, and I'll just be like, "Hey, if you want to watch this video, we did an hour-long one, and we did
Sure.
a 15-minute one. Just go watch it. Tell me what you think." But I just tell them up front, like, I will never prescribe an AI ever. Will not happen.
Yeah.
Um, every now and then, maybe a SERM if somebody gets a little gyno flare, if they have pre-existing gyno, and they just need it does for whatever reason, because they would want to say, "Oh, it's because of estrogen." It's like, no, you don't know how all these things work. It just
No.
works temporarily while you get your free T levels high enough to be a good ratio. And then once you come off, usually they have no issues. Everything's stable. But that's rare. I mean, I've only done that with maybe 5 or 6 dudes over
Sure.
7 years. Yeah. So a lot of it's just trial and error and just being willing to look at things from a more evidence-based perspective. Evidence-based, obviously that term is being used loosely, but that's what's so funny about you go through medical school, you go through medical training, and they claim all of this is evidence-based. A lot of it's really not. It's anecdote based, it's belief
Sure.
based, and we all have them. But if your basic presuppositions are actually wrong, if they can be shown to be false, I think we need to call that out and go, hey, we may need to start over with what we're thinking about here. And again, that's where you get into the more trial and error art of medicine. Like, let's just treat
It
individuals
is
as
an
individuals.
art.
Yeah. Yeah.
It is. The longer I've done it, I've only been doing just shy of a decade. And hell, my whole every 6 months, every year, my mindset changes. I'm learning new stuff.
Exactly.
And that's what,
Exactly.
and as we were talking about earlier, like the fact that you now have your own business, you have time to learn new stuff, and it's exciting again.
Yep.
Reading new literature, reading up all the things
Yeah.
that you missed. It's exciting.
Exactly. It is, and there's stuff that I think that we don't even have a clue on. And in 100 years, people are gonna look back and go, "Wow, those people had no idea what they were talking about."
Yeah.
Um,
It's
but
part
that
of it.
doesn't mean they're gonna be right either. That's
Yeah.
the thing. And again, I mean, we've
It's the
discussed
progression
this.
of life.
Yeah, it is, and a lot of the medical research, I don't think people quite understand medical research in general is not science. It's anecdote, it's correlated, it's observational
Hmm.
studies. Even randomized controlled trials are about as close as you're going to get to a scientific method type thing, but those are usually for an intervention, right? Those aren't for baseline physiologic functions in the body. Those are for what happens when we give this drug, right? That's what those are
Yeah.
for.
On
Compared to
endpoint.
placebo effect is huge. I was discussing this with my patient on Friday. So he does drug discovery, and he said your mind would be blown how many times the placebo works better than the drug they're testing, and they just chunk the drug, and then you never see that study, right? But the mind is so powerful. And that's the reason I say that, is that if you believe something's going to do something, a lot of times it might do
It
it.
will.
And nocebo. If you believe you're going to get a negative from something, you're probably going to find a negative.
Yeah.
So,
That's one thing I tell people is stay off of Reddit.
yep.
Stay off of Reddit because you will manifest all the negativities that you read on Reddit. Do not get on Reddit. It's like your worst enemy if you're a newbie.
Absolutely, man. It's, there's every now and then again, you got to be your own expert. So you have to but then you're like, well, how do I do that? It's hard. Like, you spend time reading things, you use logic, you try to really find out the people that seem to know what they're talking about, and then you go try to validate that with what they're saying. If you find people who are just saying stuff without validation, if you ask somebody, how do you know that? And they just throw an ad hom at you, or everybody
Sure.
knows that dude, like, that's a red flag. Like,
Yeah.
people who truly know what they're talking about will at least have a reasonable response
Sure.
to, and they'll also be able to say, hey, go look here, here, and here at this stuff, see what you think. I may be wrong, but just be honest, be humble. Like, these guys on Reddit, man, it's a minefield. Like, just,
Dude,
ugh, it's icky.
it is. It's the worst manifestation of anything you can think of on there.
Yeah. Yeah. So, my best patients spend very little time on social media in general. I'll just say that.
And
Like, they
that's
just,
how you know when you are dialed in, you don't give a damn about what's out there. What you
right.
read, what you hear. You don't care. All you care about is this guy right here. That's all you care
That's right.
about.
That's right. You're feeling good and you're doing all the things you want to do. You're being a better family man. You're being a better person. You're working out. You're improving your health. Like, that's what it's about. It's not about sitting online and reading a million diverging opinions and then just never knowing what to believe, you know?
Hmm.
So,
I hear you.
yep.
Have you started exploring, or do you ever treat like a DHEA with pregnenolone? Have you looked into those things?
Every now and then, if a guy asks about it, I'll usually do pregnenolone first if they feel like they're having something that might be benefited, with a little anxiety, loss of penile sensitivity, things like that. But honestly, I'll just say that the more times than not, when we've either added one or the other, people feel worse, or they feel weird. I tried both at different times, and I had some more like negative sexual side effects. But every now and then, I have had somebody who were like, "Yep, that's all it took was that little 25 milligram pregnenolone at night, and I feel great." And I'm like, "Hey, again, trial and error. I just don't base it off of blood work. I try to base it off more like, you may want to try this. DHEA, I feel like, is a bigger wild card. I feel like I see more negatives with DHEA just personally. Anxiety, acne, just,
Anxiety, man.
yeah,
Ooh,
yeah,
you can get revved up.
yeah, water retention, things that are blamed on estrogen, of course, but it's like, well, why are you taking all that DHEA, you know?
Yeah.
Well, my doctor said I needed it because this study said this. Like, well, go read the study. Like, did it really look at DHEA? How was it given? How did they study it? Like, was it a cell culture study? You know what I mean? Like, people don't necessarily go looking that far, but I do, at least when I have time. And so when you start tracing some of these papers back, you're like, yeah, I can't use that. I can't extrapolate that to a human, you know? So I think we need to be more honest about that. The cell culture stuff, we've talked about that years ago. It's bad. I mean, it's really bad. And even researchers, called that out a long time ago in cancer research and all that stuff. It's the same thing.
Yeah.
The minute you put cells in a culture, they already start changing and
No.
mutating, and they look like cancer within like days. Well, why are you studying drugs and all these other hormones on those kind of cell lines? They're not in a tissue anymore. They're not functioning as a whole. So it's bothersome to me. So we just need to be looking into a lot of this stuff a little deeper.
Oh yeah. That, or you have study done on a bunch of Sprague Dolly rats. You're like,
Yep,
are you
that's
a
right.
Sprague Dolly?
They
You
love
gotta,
those. Yeah, zebra finches and all this stuff, and it's just like, you don't have a clue what any of that stuff means. And even, in fact, if you really want to go down those rabbit trails, you start looking at the labs they're doing and how the claims they're making versus how they got the lab, and you're like, you can't make that claim based on where you obtain that. And you're talking about brain neurosteroids. How are you measuring neurosteroid levels in
Yeah,
the brain?
in a
You know what I mean?
knockout mouse or whatever.
Oh my God. There's so many layers of presuppositions that have to be validated. And they're like, no, we're just going to assume all these things are true. Therefore, this is what the data means. It's like, yeah, little kids do that all the time too. It's called storytelling. Like
Yeah.
you need to be careful with that. So, yeah.
No, I feel you, man. Some of the studies you read, just there's no applicability to humans, none
Exactly.
whatsoever.
They just bang out papers because they can and that gets their name on the paper and
Hmm.
whatever. I mean, but just be careful with that. I used to be more one of those like, well, the abstract says it, so it's got to be, that's got to be legit. Well, you go read the actual paper, then you're like, oh, this is terrible. So,
Yeah,
yeah.
I feel you, man. Well, I
Yep.
appreciate you joining us today, man. I love picking your brain, love just shooting the shit and just chatting
Absolutely.
with you.
I love it. Yep. I could talk about stuff. You know me. I just kind of ramble. Kind of like, at Allie's, a couple of years ago, I think I just got up there and just talked. I don't think I used a single slide. I tried to, but I get so like wrapped up in these topics that I'm passionate about. And I don't want people to think I'm like, I've seen people say stuff like, oh, he just thinks he's the only one right about this. I'm like, no, I don't at all. I'm open to always changing my mind about most
Sure.
things.
But
If you
present
can
me evidence. Present me
present
some
me
evidence, and
evidence
I'll look at it.
and know what evidence is. Don't give me correlation studies. Don't give me all this nonsense. Evidence is truly, and it's hard to find true evidence for a lot of things because people have a lot of things you can't study like that. You can't study certain variables in isolation and control everything else. You just can't do it. It's not, you can't do science on a living human
On a
being.
living, no, you can't. And
So
you
the
can't approach it
best
that.
you do. Exactly. And so it is kind of the best you can do, quote unquote, to do these observational studies. But when you know the fallacies involved with that, then is it really the best? Does it actually mean anything at all? Like it might generate a hypothesis, but if you can't test the hypothesis, what's the point? And so again, that's just where I think the trial and error, the art of medicine, the pragmatic side, like I look at a lot of this more like a nutrition expert would look at food. What's your
Sure.
goal? Let's try this. Everybody's different. It's not, oh, you've got a food deficiency, so we need to fix it. That's not what they're doing. I mean, they might in some people if they're starving themselves, but it's not always that cut and dry. It's more like, what is your goal? Same with PED use. What's your goal? Why are you taking that? You always have to have a specific, it's not natural to go around and throw weights around in a weight room. I mean, that's not, that's
Yeah.
contrived. It's, people want to get on this naturalistic fallacy. It's like, well, it's not natural to wear glasses, but I
It's not
am
natural to
because,
be on Zoom, I
yeah,
mean, what's
yeah.
natural at that
Like,
point?
what does natural mean? Like humans take the world, we manipulate things with technology to achieve a goal. That's how I see hormones. I really do. I used to think it was just this, we're replacing a natural deficiency. And I think it's way more complicated than that. And I have
Yeah.
no problem saying that.
And I think is the more of if you look at it, and you already do this, I wish more clinicians did, but I think if you approach medicine with a bit of a philosophical perspective, then you start to see all the moving pieces. You start to see nuances,
Yep.
inter-individual, intra-individual,
Yep.
versus let's look at this paper, let's look at this range and apply it to you. And
That's right.
too many people do that. They don't do that.
Well, it's the same. Let's think about lab ranges, right? People go, that's the normal. Okay. So how do you get where you should be an ought from an is? You can't. David Hume destroyed that years ago. You cannot get a value claim from just what is. And that's why I'm a libertarian, right? But people that go, oh, natural law, it's like, what are you talking
Yeah,
about?
I think I
If
am
you
too at this
if you
point.
look at nature, you're not getting right and wrong from nature because nature, animals do a lot of crazy crap, right?
Animals are
So
fucking vicious, man.
yeah. So I can't look at a tree or a lion and get don't steal, right? It's the same thing with the lab range. I can't look at a normal range and go, you ought to be right here. Like, how do you know that? Like, testosterone ranges have changed so much just in 30 years. So which one's the right one? So it's sort of that's the philosophical side of things that a lot of doctors aren't thinking about that. I'm not saying they're stupid. That's not how we're trained.
That's the
And when you're
training.
in a busy clinic all day and just banging out horrible amounts of patients, they're not going to sit around and think about, now, does this lab range actually really mean anything at all? Most of them don't think like that.
No,
So
they don't. And and I can commend
exactly.
physicians. I mean, y'all work your asses off, but at the same time, y'all are one of the most heavily worked professions in the world. So you don't have time to treat patients like that until you
Yep.
do a model like yours. And
Totally
actually,
agree.
I do actually have a few questions directly from some people I've actually asked. First one is, what is SHBG and what is the purpose of SHBG? I'm sure you get that one a lot, you know.
Yeah, I do.
Or-
And the more I look into that, again, rabbit trail, it's a glycoprotein supposedly made by the liver in the blood that they say, specifically binds sex hormones. Whereas like, albumin, we all kind of know albumin, or we think,
It's kind of loose and all that.
albumin
Finds a lot of
loosely
shit.
binds everything, they say. And then, a lot of this is based on computer modeling. I'm just going to tell you that. If you go really look at the older SHBG studies, it's a lot of, again, assumption calculations with modeling. They're not, to be able to directly test sex hormone binding globulin to testosterone is going to be a lot trickier, especially inside a human being.
Yeah,
But supposedly it binds, that was the thought for a long time. It binds the sex hormones so they can't be used. They transport, they'll disassociate from the sex hormone binding globulin to eventually get in through the tissue and do their thing. So recently there's been some speculation that sex hormone binding globulin bound to sex hormones actually does still get into the tissue and function. And that actually kind of makes sense in a way. I mean, it could be either one, the way we're designed, maybe it does work that way. Maybe our thoughts on bound versus unbound being useful or not are two separate categories altogether. So I think that's again a philosophical discussion that would have to be fleshed out. We are a lot of times able to correlate SHBG levels sometimes with how people feel when they're on treatment. Even that speculation, because I do have guys that don't fit that range. But, a lot of times in general, you see these super low SHBGs with guys with diabetes, insulin
a
resistance,
fatty liver and all that stuff,
fatty
man.
liver, and that is what it is. So those guys are already going to have other issues going on metabolically when they take testosterone. A healthy person who just has low SHBG, let's say they've been on testosterone for years and it's suppressed it or
Sure.
whatever, we feel like, and we don't know for sure, that more frequent dosing will a lot of times help those guys feel better than doing like a once a week dose or twice a week. And that was my situation. I correlated it with how I felt when I was on injections. I had a SHBG of 11. I wanted to try more frequent dosing, but I switched to cream to do it. And then I
Yeah.
felt better, but I can't claim that I felt better because of my low SHBG and my daily
No,
dose, just because cream may just make me feel better. It is what it is. We know that no, high SHBG will often come down when you treat someone with an androgen, right? We know that. And their free testosterone will go up when it's calculated or measured either way. So there is a correlation between free testosterone and SHBG. Whether that's the causative part or not of the free, I'm not clear on.
sure.
You really read the papers, the way they word it, they're very careful and say correlated with. They don't claim the causative part, and
Yeah.
so we insert the causative part in our minds. So I'm on the fence with that. I don't think we make a bigger deal about SHBG a lot of times than we should. That's become like another hot topic
People want to
because,
chase
again,
it for some reason. They just
people
want to
want to
chase it.
chase people want to chase data. They think data is, I'm like, data is meaningless without an interpretation. It's just data. You don't know if it doesn't, how do you know what it means, right? Like all these people that want to check every lab. I want to check everything. I'm like, why?
I want
What
to
are you
check a
gonna,
sed rate. Like,
yeah, why?
why?
Yeah. Yeah, it's the
Doesn't make
same
sense.
principle. No, it's the same principle. Um, so I do think in general with SHBG, we can kind of make some certain, it helps us guide some of our clinical practices at times. Like, well, you may want to try more frequent dosing if you have it low. If you have a super high SHBG, you may be feeling that way because you're high SHBG. So you need testosterone, even though it's normal range. Your free T is like single digit, right? And so you do see that. And so a lot of times those guys, you get them on testosterone, it overcomes that SHBG and they feel better. And
Yeah.
that's how you overcome high SHBG. You don't need to take boron. You don't need to, go high carb. You don't need to artificially manipulate your SHBG. If you need the hormone, take the hormone and that'll get the job done. That's the other big issue I have with let's change this endogenous marker instead of just going to here's what you need to take to feel better. It's very rare that you're going to see somebody take boron and go from a free T of 2 nanograms per deciliter to a free T of 25 nanograms per deciliter.
Yeah.
You're not going to do that. You
And I
need to
mean,
take testosterone for that.
yeah, just take more testosterone. Just tweak
Exactly.
your dose a little bit. No, and
Yep.
even like some of the boron studies, I mean, they're done like elderly patients. I mean,
Yeah.
who cares if it would have changed 5 points in an elderly person who's already deficient? Doesn't matter.
That's exactly right. And people need to understand the difference between a statistically significant change and a clinically significant change. just because you can go lose weight and change your testosterone by 100 points, do you feel any better overall? You might feel better because you lost some weight, but you're okay. You went from a testosterone of 300 to 400. You still have all the low T symptoms.
Yeah.
So yeah, but I mean, I changed 100 points. So what?
Yeah. Like
You know what I mean? Like you're chasing numbers. You're still in that number mindset, basically.
Tonkat Ali increased it by 200%. Oh, so
Yeah,
you went to
yeah,
like from 50 to 100. So what?
yeah,
It doesn't
yeah.
matter at that
Tribulus,
point.
tribulus terrestris, or Clomid. Look at my numbers on Clomid. I'm like, how you feel? I feel like crap. I'm like, so the numbers don't really matter, right? You know, there's something else going on, basically.
What is your speculation as to why Clomid makes people feel like shit? I've had a guy come to me on Clomid, said he was fucking suicidal, depressed because of that.
Personally, I believe it's likely due to the inhibition in the brain,
Yeah.
because that's where you're going to get a lot of the senses of depression. I had it. I took Clomid in college after a steroid cycle. It was horrible. Like the utter despair and just misery I was feeling when taking it. I mean, I'm getting pimples everywhere, but I'm also just like super emotional. Um, I don't know that I think that in my testosterone recovered, you know, and everything. I didn't really check it back then. Um, I speculate that it's what's doing here.
Yeah.
And for people to be willing to put themselves through that just to chase a number, for the fact that urologists are willy-nilly putting people on Clomid instead of testosterone,
Testosterone. Hmm.
it's honestly, it's tragic, honest. I mean, it's that's not okay. Urologists should not be afraid of giving people testosterone, but that's their new thing because they know people will be compliant with it because it's a pill. Insurance might cover it. If not, it's still cheap.
Cheat.
And they don't have to worry about all these things they shouldn't worry about in the first place. Like
Yeah.
they forget about the fertility side, you know. It's like, well, there are ways to mitigate that. You don't have
Yep.
to give everybody Clomid.
No DEA compliance. I can just send in once a year,
Exactly.
easy.
Yeah,
No
it's
labs, no
easier for
nothing.
them. Yeah, it's easy on their end, but it's not doing the right thing for the patient, in my opinion.
No, man, I totally agree. I'm,
Yep.
I totally agree. I'm curious though, like, in terms of like the fertility side of things and natural endogenous production restart, have you ever seen guys come off TRT and their natural production come back? What is, there's a fallacy that says that, well, I say a fallacy because I've seen it, but the general consensus is that you get on testosterone, you cut your natural supply off for life. What have you seen?
Yeah, no, I only had a few guys that have actually really come off, and I will do a traditional, PCT type thing with them with where a little bit of HCG for maybe the first 4 weeks. And I like tamoxifen. If we're going to do anything, we do tamoxifen
Mhm.
instead of
That's what I
Clomid
use.
because they feel better on it. It still gets the job done. If you look at papers comparing the two when it comes to regaining natural production, they're
Hmm.
pretty much equivalent. So it's like I would rather use something that people tolerate better from a mental standpoint, but it's just short term. It's a couple months, and then we check levels to make sure they actually regain something, and then they come off to see if they stay there. If they don't, you really just need the testosterone. But as far as fertility maintenance when on it, again, HCG can with most guys can help that. And then if they go to zero or still go down, we can add follicle stimulating hormone, and that typically gets the job done. If it doesn't, there's probably something wrong with the testicle
Itself,
itself.
sure.
And that's a whole nother can of worms that they do have to see like a fertility trained, urologist for.
And at that point, they pretty much have to get it actually manually, withdrawn from them directly.
Exactly. That's right. Like a testy, microtesty, some kind of sperm extraction. Yep.
Gotcha. Okay.
Yep. Yep.
Um, any closing words for guys that may be on the fence, maybe thinking about, it, or if
I
they
would
need a
just,
way to reach out to you or anything?
you know, um, as far as thinking about this stuff, just be open-minded with it. Start reading papers and start thinking about the lab ranges maybe from a different perspective at times. Talk to guys that have actually gotten treatment with like me or you, or get on our Facebook group and realize that the guys that feel the best are not being treated by pure numbers alone. The guys having the best results have providers that are willing to treat them like humans, work
Sure.
with them, and find out where they feel the best. And so I think that's the main thing is, and don't just believe everything you hear. Don't believe fear mongering from your primary cares and endocrinologists and all this. Like when people try to fear monger, oftentimes they don't really know what they're talking about. And so that would be my biggest advice. And
Yeah.
just try to be your own expert the best you can. I mean, a lot of people are going to read papers and go, I don't have a clue what these words even mean. And that's fine. But try to be your own advocate. And I think you'll go a long way in being able to discern experts from quote unquote experts from true experts who are humble and are willing to admit that when they don't know something.
Yeah, for sure.
Yep.
Right on, man. Right on. So if anybody's interested in reaching out to you after your trip, your big vacation, how would they do that,
Yeah.
man?
So our website, granthormone.com, that's the best way probably. www.granthormone.com. Right now I'm limited to previous patients only. But like I said, that's temporary, honestly. I think just while I catch my breath, I was getting to where I couldn't even keep up with the emails because we don't have employees. Like it's just me doing my guys. I'm the scheduler, I'm the office, the biller, like everything.
That's cool,
Um,
man. That's how
and it's
medicine
fun.
that's how it
Yeah,
was, man. You
I
just hit
know.
up your dog.
And I'm making like house calls. I'm literally I've seen people like at a restaurant in my hometown instead of going to the office that they just want to have a chat. Like I love it. I love the fact that I could, if I have a family friend that wants to see me, it's like, yeah, I'll meet you at the local wherever and we'll just talk, have a lunch and talk about it. So it's just been very freeing. But yeah, it's very cool to be able to do this and on my own. A lot of guys are trying to like schedule themselves, through the portal, and I don't allow that. I'm like, nope, I do all the scheduling myself because I know where I want to put people. I hated as a urologist when people would get shoved in slots that weren't the right slots, and I never had a say in it. So I'm very like particular about that kind of stuff.
Sure.
So it's nice kind of having that level of control to be like, no, I want this guy to be a 90-minute and that guy can be a 60-minute. Like you never know until you start talking to some people going, hey, what's your background? Are so it is cool to have that, unique ability to decide all this on my own. But again, that's why I'm kind of limiting things right now. But I have a feeling maybe by May, I bet I open back up to new patients. And I might have to cut it off again after that point. But I just want to get some breathing room to see how things kind of settle
Yeah.
out right. Yep.
Man, I'm happy for you. Just enjoying life. You
Thanks, man.
deserve it. Love seeing
Same for
people
y'all. Y'all
just
too, man.
enjoy life.
Yeah, and you're the same boat, man. You guys are living beautiful property. You're married now with a baby on the way. I mean, it's funny how all this stuff kind of changes as life changes with you and you get a new perspective on everything.
Yeah. And that's a testament that testosterone will not make you sterile because
That's right.
ta-da, we got one on the way.
That's right. I
Hey,
love it.
hey, thanks for joining us. Appreciate it.